Yeah. My goodness. We are on the Life and Health Show today. And we welcome you. If you are joining us for the first time, thank you for joining. And if you are a repeat watcher, thank you for coming back. And if you happen to scroll through and you saw us, don't leave. Stick with us and let's roll together. Come on, man. It's a beautiful day today. Our slides for today. And as we said, we are going to be talking about the dangerous link between diabetes, heart disease, and stroke. And so, with that being said, can I move forward?
Yeah.
With that being said, we just want to say that if you have any questions, make sure that you put it on the stream. If you watch after we are live, we will still be monitoring for your comments and questions. So don't hesitate to add your comments and questions as we move forward. And so these are the things we're going to basically dwell on this stream. First one is how insulin resistance can lead to inflammation, or to be short, insulin resistance or high blood sugar levels leading to insulin resistance that also leading to inflammation. Want to say the next one?
The next one, persistent high glucose can lead to atherosclerosis. So we are going to try and elaborate on that. If your glucose is persistently high, what are the dangers? And what's the need for you to be able to manage your sugar level so that it doesn't stay persistently high to lead to atherosclerosis?
All right, we're going to talk about that. And then we'll move to high and abnormal cholesterol levels coming down from, again, unmanaged blood sugar levels. All right, and then you go to
and also how high sugar level can lead to high blood pressure.
Oh my
So
goodness.
what's the link between having your sugar level uncontrolled leading to high blood pressure?
High blood pressure or hypertension. All right, and then we'll move to diabetes and increased risk for clots. This is where stroke comes in handy. No, that is good handy. But you get the idea. You get the idea. Diabetes as a disease leading to increased risk for blood clots. And then finally,
and the last one, the synergistic effect, how having a high glucose level and heart disease and stroke, how are they related to each other?
All right. So with that being said, I think we can move on to our first slide, which is to ask you to hit the like button. If you haven't already done that, hit the like button and hit the subscribe if you are watching from Facebook, YouTube, LinkedIn, wherever you may be seeing us from. Make sure you hit the like button and follow button on Facebook and LinkedIn, and on YouTube. Do us the honor by subscribing so that we will roll together. We have a lot of videos on several things, but this month happens to be diabetes month. So even if you are not a fan of this topic, still subscribe, because there are certain things that are already on the channel that you can basically like. With that being said, we'll zoom on to the first topic we're going to talk about. And the first one is insulin resistance and chronic inflammation. How uncontrolled blood sugar levels lead to insulin resistance, and then that in turn leading to chronic inflammation.
Okay. So this one is more for people that their sugar levels are not controlled. So if you are able to control your sugar level, this may not happen to you. And as long as you stay on point, your diet, your exercise, you are taking your medication, we are not here to scare anybody. We are here to inform you the importance of controlling your blood sugar. So if your blood sugar is not controlled for a long period of time, it leads to insulin resistance, meaning that you are not able to use the insulin that you are producing to break down the sugar. in your bloodstream. So if the blood sugar stay in your bloodstream for so long, then this can lead to chronic inflammation. So inflammation is okay when you hurt yourself, and you need the white blood cells, you need the cytokines, you need the inflammatory cells to come in and help heal. That's okay. But if your sugar level is persistently high, then it can lead to chronic inflammation, meaning that the endothelium of the blood vessels are being compromised because of the presence of sugar in the bloodstream. It can lead to damage in the blood vessels, and that can lead to inflammation, meaning that you have white blood cells, the cytokines, and all that coming in, the calcium coming in, and then your bloodstream or your blood vessels becomes inflamed, and that can lead to heart problem, which is linked to the heart and the stroke that we are talking about. So here we are here to encourage you. If you are controlling your sugar, is very important. You go to your doctor, and after 3 months they check your INR, and you are on point.
A1C,
the the A1C, and it's right under 7, right?
Mm-hmm.
If it's under 7, you know that you are doing all the right things. Just yearn for that, so that your numbers are controlled for a long period of time. And if you go and your numbers are out of control, there is a need for you to pay attention to your diets, your exercise, and the insulin and the medication that you're supposed to be taking, so that you don't find yourself in this situation.
All right. That is what's up. All right. So yes, she said, I don't have anything to add to inflammation except to say, she said the inflammation is good if it is an acute situation. You get a cut or burn and there's inflammation. That's not the kind of inflammation. That is good because that helps you heal. But if your sugar levels are so high in your blood, your body sees the sugar or the glucose as foreign. And that is why you become inflamed. Your whole body becomes inflamed. So you are a walking sick person. According to your own body, your body thinks that because the sugar is way out of proportion, you are not feeling good. And so all the cells that she mentioned begin to get mobilized to see that they can control the sugar. But because it's chronic, because the sugar is not like, oh, it was up to date and it didn't go up anymore, but consistently, because you are not controlling it due to insulin resistance, because your insulin is not working, or your body is resistant to your insulin, which in this case is type 2 diabetes. If you don't understand it, you can go back to our first video. We talked about the types of diabetes. In this case, it's type 2 diabetes because you are insulin resistant and your insulin is not working. In that case, then the inflammation, the glucose is persistently high in your body, and your body sees it as foreign. It's too high means it's foreign. If it's normal, it is okay, but if it's too high, it is foreign. And anything that is foreign in your body will demand inflammation. And that is why we have chronic inflammation. But then, as she said, there is hope. If you are treating your type 2 diabetes, then this is not you. Obviously, over a long period, if you have diabetes over 60 years, 70 years, you may still find a little bit of the inflammation going on because I'm pretty sure you're not going to be able to control it up to the number, right? Your sugar is always 90 to 110 or 80 to 110, never over it. Once a while it will go beyond 130, maybe 150. In that case, over years, you may still see some of the signs of chronic inflammation. But for the most part, if you are controlling your diabetes or your high blood sugar, type 2 diabetes, then this is not what is going to happen to you. So she said, we don't want you to get scared. We just want you to ensure that you are taking charge of your own body by ensuring that your blood glucose levels are on point so that you don't get insulin resistant and then chronic inflammation, which leads to a lot of things that we are going to see as we move forward. We'll move forward. All right, so that is that. So I hope it is very clear. Uncontrolled blood sugar leads to insulin resistance, and then insulin resistance becomes something that leads to chronic inflammation. which basically means your body is sick, your body is tired of the sugar running around, and so it's acting up for you. All right.
Yeah, and with the resistance, I think last time you made a comparison between bacteria, like antibiotic that you build
Right.
resistance to it. It's the same way. If your sugar level is not controlled, then the insulin becomes resistant to it, and you're not able to break it down or
Right.
absorb it right into the cells.
Because it's always there, always insulin. Your glucose is so high that insulin comes and comes and comes and comes, and then eventually it doesn't work. So that is what we mean by insulin resistance. All right, so that takes us to the next point. But we got a like and a thumbs up on the like. Come on, man! If you are joining us, make sure you register your presence. You can say hi so we can see your name, and you can comment, contribute, ask a question and everything so we can see that we are not alone. We see somebody gave us a thumb up, and so definitely that helps out. All right, so the next thing that high blood glucose does, or persistent, uncontrolled type 2 diabetes will do, is what we call atherosclerosis. It's a big word, science. We try to make sure people get scared of doing science. We make the words big, right? So, and it's a big word called atherosclerosis, but we are going to break that down. So, basically, all we are saying is that uncontrolled blood sugar levels or high glucose levels, persistent, and over a long period, lead to atherosclerosis.
Go ahead.
All right. So, atherosclerosis, if you watch our cholesterol season, lots of about, I think, 11 episodes of cholesterol, we talked about the process where atherosclerosis begin. And not to go there, we're just going to summarize it today and say that atherosclerosis is basically the lining of your arteries, the pipes where blood flows in and out. If that lining becomes compromised, what happens is, how does it become compromised? We talked about some of the things. Smoking, tobacco smoke can do that. We talked about cholesterol itself. High cholesterol itself can get it compromised. And in this point now, we are saying that high glucose levels can also make it compromised. And the same reason we talked about inflammation happening is the beginning point of the atherosclerosis. So high sugar levels will cause the lining of your blood sugar, your blood vessels to become compromised, inflamed. That inflammation becomes inflamed. So cytokines and other white blood cells will move there, and by so doing, cholesterol plaques will also come in there to join. Calcium will also come to join, just like the image you're actually seeing. So this blood vessel on the left side of the screen started off clear, but then with high sugar levels, that particular place became inflamed, and then cells migrated there, calcium came there, and all of a sudden the big hollow tube has become very narrowed. That is all we mean by atherosclerosis, leading to the formation of plaques. And not only is it narrow, it has become stiff. So at first it was flexible because, of course, the wall was thin. Now it is thick. How can you bend this? How can you expand it? You cannot expand it anymore. So blood flowing becomes troublesome because of atherosclerosis. And that is one of the things that the key is here, persistent high glucose levels will lead to atherosclerosis. And one of the reasons why atherosclerosis is bad, or uncontrolled diabetes is bad, is what you see down there also on the left, heart disease. Heart disease, that's why we say that it's a dangerous link to have diabetes uncontrolled, because it leads to stroke and it leads to heart disease. The heart that is pumping down, the arteries on the heart, they are supplied with oxygen. The blood that is going even into the muscles of the heart, they carry oxygen. So if any of those lines on the heart, as you can see pumping, I'm not sure if we have another one that has a bigger. No, this one is for the brain. But literally, what that does is that because of the narrowing, as you can see on the top, blood flow to either your brain or to your heart muscles become compromised, and therefore you get heart disease. That's coronary artery disease if it is in your heart. If it is your brain, it can lead to stroke, because any of this plaque that is there can break off and cause a clot, which then will cause a stroke. Or if it is in your, as we talked about the carotid artery, if this pipe here is from the one that goes to your brain to supply the blood to your brain, and the blood cannot flow, just imagine what you will feel. Your brain is going to be shut off without enough oxygen. You will still be moving around all right, but that wouldn't be a healthy brain. So these are some of the things that atherosclerosis can do. And remember, this time it's coming from diabetes type 2, which is not controlled. And so it is not a good thing to leave your blood glucose levels hanging in a high amount persistently. Again, like I'm saying, if you didn't know and it was high, you didn't know. But if you know, you got to take charge, man. Come on, man. You got to take charge. Because if not, you are leading to a stroke, heart attack, or heart failure at some point. You have anything to add?
Yeah, so you said that the arteries become stiff, right? So like if the arteries around your heart is all stiffened, it's all stiffed, there is no way the movement of blood is going to be smooth. So it's likely that you are leading to heart attack and heart disease. So your heart, the arteries around your heart is all disease, it's all stiff, then you are in for a huge trouble. That's why people will be like, we have massive stroke. Some people have the huge one, the big one that can really paralyze you, all because your sugars are not being controlled. So it's very important. We can't stress that enough, right? You don't want to stay persistently on the higher level. You have to try and control the level. And I think last time we mentioned ways and means to help you know where you are at every point in time. Because like if you wake up and you have no idea whether your blood sugar, the medication that you're taking, the insulin that you are injecting is controlling the levels, you need to know. So last time we mentioned the importance of testing your blood sugar every morning. I know some people that are on regular medication like the pills, you are asked to test at least once a day so that you have an idea where the levels are, so that you don't stay consistently on the higher level, so you have an idea where you are, so that your diet is checked, your activity for the day is checked, so you're not going to be the inactivity, you're going to be just sitting at one place. If you test your sugar in the morning and it's high, you can make a lot of life changes for that day so that you know. So the importance of knowing is very important. The importance of trying to find out is very important, because if you test it every morning, the test strips, they are not expensive. We mentioned last year, just put money on it. Just buy it if your insurance doesn't pay for it. And at least you have an idea where you are and be able to control it so that you don't persistently stay on the higher side.
All right. I know that she said it's not expensive. Maybe not to her, but I know that she's a rich woman. But for some people, it may break the bank, and that's okay.
No, the store brand is
The
not
store
that.
brands are
Yeah.
less, expensive compared to the brand names.
Right.
But my point is that even if you cannot afford, you can afford a lifestyle change. You know the diets that you eat that bring your sugar levels high. You cannot say that, as for me, I can't stop eating this food. That's all I want. And you know that food brings your sugar level high. And you can't afford to, test your sugar levels in your blood and you still continue to eat. That's like, you don't want to change, and we are all about lifestyle change. For those of you who eat fufu, potatoes, fries, rice, and that's all you eat. If you are over the age of 35 and 40, according to the risk that we discussed, it's not me. You got to watch out, because you're going to increase your risk for diabetes and consistent or persistent high glucose levels, which eventually will lead to this. So we hear people getting massive stroke, massive heart attack, and all that. We know that it's not only this that causes that, but this increases your risk. So if you can manage it, why not do that? So I think that's a good point that she brought up. Make sure that you are in charge of whatever it is that you are dealing with. If you can afford, there are always dietary lifestyle changes that you could do to make things work out for you. All right, can we move forward? All right. So with that, we move to the third point on our discussion today, and that is that high glucose levels or uncontrolled diabetes, persistently high blood glucose levels or blood sugar levels also lead to high or abnormal cholesterol levels. Oh my goodness, come on, man. So you see that one disease state or one condition is permeating through everything. It's basically your cardiovascular health is completely overshadowed by your blood sugar level. So if you want your cardiovascular means your heart and your blood vessels. That's what all cardiovascular means. It's a huge word, but we break it to two. Cardio is your heart, vascular is your blood vessels and the pipes that run through your body from your heart. And blood sugar levels that are not controlled or high blood sugar levels destroy both. And we've already talked about a few. The third one here we're mentioning is your cholesterol. If your sugar levels are high, your cholesterol levels become high. I don't know if you want to add anything, but it is just a matter of evidence that people with consistently high glucose levels, type 2 diabetes, all the time, for the most part, their cholesterol levels become high and abnormal. Now, high means that your LDL levels will shoot up, your triglyceride levels will go up, and if you don't know what that means, your bad cholesterol levels will go up. Basically, triglyceride levels will go up. The fat that is deposited around your belly. All those things are the sign that your cholesterol levels are high because your glucose levels are high. You are probably resistant to your insulin that you produce, and so those cholesterol or lipid levels are high. And then dyslipidemia, abnormal cholesterol levels also is that your HDL also comes down. Not only is it that the bad ones are going up, the good ones that should take care of you also come down, which makes sense because if the good ones were a lot, you probably wouldn't have a lot of the bad ones, right? Because according to our show last time, the higher the amount of the good ones, the lower the bad ones, because the good ones will chew up the bad ones, if you remember. So high glucose levels are definitely not your friend. It's going to lead to high cholesterol levels. And we all know what high cholesterol levels. We're going to talk about that in a second if you have anything to add.
So like being diabetic, you are the lipid metabolism is compromised because you are diabetic. So the lipids, the fats that you eat.
Yes, I wanted you to break it down. Lipids is the fat, the regular fats that we eat and absorb.
So we know with our discussion with cholesterol, we need LDL to function. In some of our cells, we need the LDL, which is the bad cholesterol, a certain level. You don't want to go too high. So because you are diabetic, being diabetic will not help your body to get rid of the excess. It compromises the metabolism of the fat, of the lipids that you ingest. So you tend to stay on the higher level because you are diabetic. So it compromises the way that lipids are broken down in your body because you are diabetic. And it also compromises the formation of the HDL, which is the good cholesterol in your body. So high glucose level compromise the way that your lipids are or your cholesterol levels are in your body.
In your body. My goodness, my goodness, my goodness. All right, so with that being said, what are some of the things that high cholesterol levels will do? Again, high cholesterol levels will build up plaques in your arteries. And so that is why we say there's a dangerous link between diabetes, stroke, and heart attack. So in this slide, you can see that heart is trying its very best to pump the blood, which is good. It's doing a lot of work. It's expanding, dilating and contracting just to squeeze out blood. But before it can do that, it has to have a rich supply of oxygen through the little pipes on top of it. And one of them is the blue one, and then you can see the red one. So the red ones are the ones that are taking in blood, fresh blood with oxygen and food nutrients to the muscles of the heart so that the heart can squeeze the blood out and do its work. Yeah. Now, when your lipids are off or they are too high, as in the bottom picture, you are forming closed up coronary arteries, or the tubes on your heart are closing up. And so for some people, when they have not gotten into a full-blown heart attack, they would say that when I climb a flight of stairs, my heart beats and my chest aches, my chest hurts me, And so your doctor may give you some medication for chest pain. You are on the way if you do not take care, because your heart is not receiving enough rich oxygen supplied blood, all because the coronary arteries or the arteries on your heart are closing up due to excess cholesterol or atherosclerosis, which is being demonstrated on the bottom picture right there. And so diabetes is a bad thing, or high glucose that is not managed is a bad thing. Not only is it's not just forming the plaques and the plaques just staying there, but the plaques are compromising your heart's own ability to pump. And you can get coronary artery disease, which is not full-blown heart attack, just the chest pain that you always see and you have medications for. Or you could get a full-blown heart attack. Or for some people, you won't get a heart attack or coronary artery disease, but the muscles of your heart become weakened because they don't get enough rich supply of oxygen or blood, for that matter. And so over some years, your doctor will tell you that you have heart disease. Why? Because your cholesterol levels are up the roof, or they were up the roof before you found out, and all those blood vessels on your heart are closed up. And so people, let's watch out, because uncontrolled sugar, uncontrolled diabetes is not your friend, and you don't want to get diabetes if you're not already diabetic. And it's not far away. If you see somebody that is diabetic, it's not because they ate too much or anything, because they did not see it coming. And so if you have this information, you can arm yourself and protect yourself from even getting there in the first place. Anything to add?
Yeah, and I think according to American Diabetes Association, they encourage people that are diabetic to be on cholesterol medication. I think our job sometimes we talk to patients and encourage them to talk to your doctor, so that if you are diabetic, you are encouraged to be on a statin, like medication to control your cholesterol level, because they've realized that the link between the two is huge. Because you are diabetic, you are not able to metabolize the lipids in your system. So your tendency of having a high cholesterol is there. So people are encouraged that if you are diabetic, you have to be on cholesterol medication, especially uncontrolled diabetes. You are encouraged to be on cholesterol medication. So if you are diabetes and you go through your medications that you're taking and there is no statin on board, you can mention that you can bring that to your doctor, because there is a study that has proven that it helps people with diabetes.
All right. There's a study that says that taking a low dose, it doesn't have to be high. And I've called some patients of mine before and asked them why they were not on a cholesterol medication because they are diabetic. And they're like, oh, my cholesterol level is good, and so I don't need. No, it's not just because it's good. It also stabilizes the endothelium. It makes the lining of your blood vessels stable, so that nothing will break off that was already formed and cause a clot or a heart attack because it lodged somewhere. It makes your endothelium, the endothelium of your blood vessels, stable, or the lining of your blood vessels. So yes, if you are diabetic and you are not on a cholesterol medication, ask your doctor and say, Doc, I could probably use maybe a low dose. You don't need to give me 40 milligrams. Especially if your levels are not high, it will just prevent you from any unnecessary break off of any old plaques. All right, so that's a good point you brought out there. All right, so now let's see if there is anything. The next point that we can talk about from our slide is that high blood pressure is also a result of high sugar levels.
Wow.
My goodness, who would have thought, right? Who would have thought? So, you want me to take that?
Yeah.
So, there are studies that have shown that people who eat a lot of sugary foods actually have increased blood pressure levels, I should say. So, if your diet is made up of sugary foods or starchy foods or carbohydrates, for the most part, your chances of getting more high blood pressure or hypertension is higher than somebody whose diet is more balanced, less carbs, maybe a little bit of carbs, greens, fruits, veggies, and stuff like that. Those people have less blood pressure levels. I've been to a doctor before who told me that cut back your starch so that your blood pressure levels will go down. And there's a study also there that sugar itself, when you consume sugar, whether you add it to your milk or your tea or your coffee or whatever form that you take your sugar in, donuts, barbecue, barbecue. Yeah, I'm like, man, why do you have to add sugar to meat? But barbecue sauce
It tastes good.
tastes good, right? Come on. All those foods have sugar added, and sugar itself gets converted to uric acid, and uric acid eventually is the one that causes your blood pressure to go up. So if somebody is eating sugary food or high starchy or high carbohydrate food all the time, the typical local ones that we know, as well as real sugar added like donuts and stuff, that person has a higher incidence of, hypertension than somebody who is not. And so if you have diabetes and your sugar is not controlled, then it's a fact you are most likely going to get high blood pressure compared to somebody who doesn't have diabetes. I hope it makes sense.
It makes sense. But normally, if you think of high blood pressure, we think more of salt, right?
Yes.
That we think that if we ingest too much salt, you tend to retain more fluids and your pressure will go up by increasing. But now, today, we are learning that it's not only salt, it's also sugar. Because if you're diabetic, your levels stay consistently high, it's likely that you are going to affect the blood vessels. And if the blood vessels are compromised, we talk about arteriosclerosis, we talk about inflammation. It means that your heart have to work harder, and by working harder, and we talked about your blood vessels being hardened. So if it's all happening at the same time, it means that your heart have to pump harder. And the more it pumps, it's going to work harder and the pressure will definitely go up because it's working against resistance. And as it work harder, your pressure have to be increased in order to overcome all the things that are blocking the blood flow. So it's not only salt, it's also sugar that we are learning today.
It's also sugar. It's also sugar. It is sugar, and we will eventually one day we will take sugar on just by itself and see how bad sugar is. But take it from us today that the Otengs are saying that if I want to decrease my blood pressure, if I want to help with my blood pressure, I should take down a lot of the starchy, sugary foods, take it out of my meals, and see if it will drop. And I bet you it will. It may not be clinically significant initially, like it may not drop it to the level that you have to stop your medications. You probably still need to take your medications, but at least it will make it more manageable so that, you may not need as many medications as you probably used to. Because I've seen people with 4 medications to control their blood sugar, and they come and they are drinking soda. Come on, man, that's counterproductive. There's no way you're going to get down to 1 medicine or 2 medicines. You're going to add more because your sugar is doing the opposite to you. And in the same way, if you are diabetic already and your sugar levels are not managed, you are also definitely going to have high blood pressure. And in fact, as a matter of fact, it's a known fact out there that most diabetics have high blood pressure. And it's usually because of how much sugar they had accumulated before they were even diagnosed. And so at that point, it may be too late to just stop sugar all completely and have the blood pressure reversed. But if you don't have high blood pressure yet and you're not diabetic, take it from me. One way to prevent it is to cut down the sugary levels. And if you are my age, which is 20 something, come on, man. And you are drinking soda or you buy, these artificially flavored drinks, put in your fridge, eating donuts and stuff. I don't know what you're looking at, I don't know what you are thinking, but you are on your way to high blood pressure. You are on your way, most likely, also to diabetes, especially if you have a family history and your age is up there. All right, so that is one thing that diabetes or diabetics should watch out for, and people whose blood sugar levels are not controlled.
So with this discussion, I think we are mentioning three things in one. That being diabetic, you can have high cholesterol, and now you can have high blood pressure, all
Yes.
in one.
All in one.
So it's all linked, so we should find ways and means to do away from all three.
And I think you explained the other way that blood pressure goes up with sugar, right? Because your sugar is high, the inflammation that we mentioned is going to eventually lead to atherosclerosis, and your blood vessels are stiffened, and when they are stiff, they cannot dilate or relax for blood pressure. I mean, for your blood to flow, and so your heart works against.
Yeah, and I think
pressure.
you also mentioned like the endothelium is compromised, and
Yeah,
because of that, the nitric oxide
yes.
is not produced.
Come on,
And
man.
because,
You are bringing out the point.
yeah, because the nitric oxide is not produced, then
There's no
the levels
vasodilation.
are not relaxed, and that's your pressure have to work harder.
Yes,
And
so
that can lead to high blood pressure.
literally, all she's saying, don't have to memorize these science words. She's smart. But all that is being said is that if your endothelium, if the lining of your blood vessels are compromised because of excess blood sugar levels, your blood vessels usually produce a chemical which relaxes your blood vessels so that your pressure will be lower. And this chemical is called the nitric oxide. And incidentally, this is the same chemical that helps if you have it, for the men who are suffering from erectile dysfunction. If you have this chemical released from your blood vessels, it will dilate not only up there, but down there too. So you can have your erections. That is why a lot of diabetics don't have the ability, to perform well as men, because they are not producing enough nitric oxide, because the blood sugar has destroyed the lining of their blood vessels. So they are not producing this nitric oxide to relax and have blood flow. And the same way, if nitric oxide is not being produced, because you are not relaxing the blood vessels, your blood pressure will go up. Because your come on, man, we are giving you a lot of info. We are teaching a lot of info. So please subscribe if you haven't already subscribed, and share the link, click the thumbs up, love it, and all that good stuff. All right, so we'll move on to the next one. All right. So the next one is the clot formation. So this is the third one, right? The third thing that high blood sugar levels can do. Oh, come on, man. I see somebody giving us a thumbs up right now. Thank you for doing that. Thank you. We see it. So keep doing that. So the next one, the point number 5 of what diabetes do is high glucose or unmanaged type 2 diabetes leads to clot formation. We call it prothrombin. What basically that means is that your blood is more prone to clotting just because your sugar levels are high. And if you can look back, it makes a lot of sense, right? Because if you are making, plaques, if you are building plaques in your arteries are being filled with cholesterol plaques, the chances are that some of them may break off. And when they break off, what happens is a clot will form, and that clot can break and then be lodged into a place called the brain, where you have a stroke on you. Or if it travels to one of the tiny arteries on your heart, it forms what we call blood stasis there. And again, you cannot, your heart cannot pump, you dropped it, and then they say that gone too soon, nobody knew what they were doing, and it happened. And then they begin to blame your grandmother who cannot chew even. Yeah, for some communities, they blame witches and wizards for everything. And that is what would then be the reason. It's not anybody doing anything, but the fact that you are more prone to clots because you are diabetic. Yes. You have anything to add on?
Yeah, so I think with the stroke and the heart attack, it can also lead to leg pain. I think we discussed that last time, that if you form the atherosclerosis for so long, then the pressure is so hard in your veins, it can break off and plug will be formed and it will start moving. So if it moves and enlarge into somewhere else, your leg or your heart or your brain, then the stroke and the heart attack and now the leg pain will also come in.
It's a peripheral artery disease you're talking about,
PAD.
right? All right, PAD. All right, before we move forward, I think we have a nice comment here. Let's put it on so we can see it. Oh, come on, man. Let's give it up for our apostle, my goodness. Today we are blessed with the apostolic visitation. You know, at church we had an apostle, our regional head visitors today, and then on the show we have another regional head comment. Come on, man, we are blessed. We are blessed. Thank you, Apostle Ofori, for that. Let me see if I can put it up again so we can read it. This is a good health information. Great job. Keep it up, Elder. And a ton of blessings to you and your dear wife. Oh, the blessings we are sharing now. I thought it was just for me. Thank you so much. Thank you so much. And we know you are a very health conscious apostle. I already know. And so I'm happy that you are sharing that info with us. So your colleague ministers, hopefully they will also be watching and have the chance to learn some of the things we are all learning together. God bless you. All right, so we'll move on to the next one. Okay, so this brings us to the last point on our show today, which is the link. We are saying that the dangerous link, diabetes, stroke, and heart disease. And as we have said so far, I think if you do not agree, you probably have to watch it again, because we have already pointed to you the danger of sugar. Is sugar killing us? That is the question that we should be asking. Is sugar actually killing us? And I think the answer is yes. It does not only lead, excess sugar, of course, does not only lead to type 2 diabetes, but even for those who don't have diabetes, sugar can lead to your pressure going up. It can lead to a host of other issues, high cholesterol, high triglycerides. For people who have a rounded belly, how do you say it? Pot bellies, right? We call it pot bellies. Sugar does that. If excess carbohydrates converting to real glucose in you, or you are adding real sugar, the natural. Real sugar is not natural, right? Artificial sugar. You're adding artificial sugar to your meals, or you're buying the sugary foods, however the source may be, whether it's from the donuts or the bread, the white bread. They may not add sugar to white bread, but trust me, that whiteness that you see is all sugar. It's just a complex sugar that is eventually going to be broken into glucose and all enrich your blood with too much sugar. So if you are dieting and feasting on all these things, then you got to watch out, because at least for this show, we have established the fact that diabetes or uncontrolled sugar levels can lead to heart diseases, which is either heart attacks or heart failure, and then also strokes, which is very common these days, especially among men. We know that stress is part of the cause of stroke, but if you are stressed so much and you don't have those other risk factors, all it's going to do to you is mental health. Trust me. Yeah. I mean, just think about it. If you are stressed and you don't have plaques in you that are going to break off to cause, a clot in there, if you are stressed and you don't have any other issue that is going to actually cause a cardiovascular issue, it will only lead to mental problems, maybe depression. And then you cry and cry and cry and cry, and then you go to church and you are preached to and you come back, or you take some depression medications and you come back. But if you are stressed and you have all these other things going on with you, such as eating sugary foods and your cholesterol levels are building up, your plaques are all choked up, you can barely walk a flight of steps. You try to climb your own house and you have to climb the stairs in your house and you have to stop in the middle way. It means there's something not working. You got to take out all those starchy, sugary, and tasty things that we call it tasty because the real food is really tasty and more healthy. I'll show you one of the real food. My wife says that anytime I go to a restaurant, I have to make sure that we got that. And I'll show you one. I'm pretty sure it's a real good one. You know, come on with this. Go to a restaurant, grab a salmon like this. Tell them you don't want too much salt with it, and then grab some salad with it. Get this down, and this is better than to get a mashed potato, which is juiced up with butter, and then get all those barbecue chicken or barbecue ribs, fat and cholesterol juiced up already, and then probably eat rice with it, which for most of the people in my community, they think if you do not eat any starchy food with your meal, you didn't eat. Come on, who says that? Those are poor man's food right now. Yeah, oh yeah. It's only the poor that thinks that way. And I'm pretty sure you are not poor. And even if you are, we can change that. How?
How?
By working hard and choosing right. Come on, man. Anyway, that's just a joke. But what I'm trying to say is that, yeah, these foods may cost you a little more in a packet.
Yeah.
But if you think about it, if it doesn't cost you higher now, you buy the cheaper food, you are going to pay for it later. Not only with money, but going to the doctor's office, calling out of work and being bedridden and potentially even having stroke. How expensive is that than to just eat something healthy and let it cost you a little bit and walk around lighter, not heavy, not short of breath when you are walking or running. Oh, come on, man. I prefer that kind of lifestyle. Right? And so, yes, we are challenging you to make the necessary lifestyle changes. Because if you don't, all that is going to happen is you are going to come up with one of these diseases, and God forbid, it takes you down, and then people become, so sad and cry for you on a thing that you could potentially just change. And sometimes you won't even die, but your life you'll become incapacitated.
Right.
The quality of life, the quality of life becomes so down. You can wash yourself. I've known people who had strokes. People had to wash them all the time. People have to feed you. If you have to go somewhere, somebody have to take you by the hand, and you want to avoid those things.
You
and
become a burden
become
to
a
your
burden
family
to your
around
family,
you.
and you don't want that to happen. And some of these little things we're talking about are all you need. I'm pretty sure that this is not just it. Remember, exercise is my mantra. You have to add exercise to it, apart from diet. So yes, I think that sugar is not a good one. And I think we have another comment, unless you have something else to add. Have anything to add?
Yeah, so I think you being diabetic is not just because you want to control your sugar. There is more to it that you have to pay attention to. So, like, that being diabetic, your chance of getting stroke is increased. Your chance of getting heart attack is also increased. And your chance of having dyslipidemia, right?
High
Your
cholesterol.
cholesterol all over
the
is
place.
also high. And all that comes with it. So just being diabetic can make you have high blood pressure, can have your cholesterol level to not be controlled, heart attack and stroke. So it comes with a lot of things that you have to pay attention to. So it's not just because they tell you you're diabetic and they are worrying you, telling you to exercise. Do you have to do all that in order not to stay persistently high blood sugar? Because if your sugar level stay persistently high, then it's likely that you are going to encounter these problems that we are talking about. So we don't want to burden your family members. There are so many things that comes into it. So we are hoping that you make lifestyle changes and do things differently. And if you are not diabetic, that is even a plus. Now you are armed with information. There are things that you can do differently. A little cost of food, like getting the quality food, or not just eating to fill your belly, but taking foods that will build you up instead of just filling your belly. That will also help not to get yourself into being diabetic.
All right. So make sure that you protect yourself and your family. And before we move forward, I also want to add that some of us too, we know the truth, and yet we let our children live the way they want. We know that eating or drinking soda is wrong, So we don't drink soda, but we buy soda and put it in the fridge, or we buy juice with all the sugar and put it in the fridge because the kids want it. Well, what are you teaching them? They are going to grow up and they are going to struggle to stop it if they even want to stop it, if they will know about the fact that it was bad. But if you teach them how to eat right from now, then when they grow, they will not depart from it. Right? So let's make those changes and ensure that it affects not just us. And sometimes too, especially if you're a couple, you are the wife or you are the husband, and you know the right things to eat, but your partner may not know. And it will be a struggle to convince them to toe the way you want things to be done. You got to lead them with example, humbly teach them, and let them see the changes in you. If you had pot belly and now you are exercising, you're eating right, and the belly is gone, I'm pretty sure if they are a spouse, they will enjoy that. You see that, come on, man, that is something that that is good, right? They are going to enjoy it. And so, and also the energy levels that are going to go up, they are going to see. It's not about just, lodging over them and making them feel bad, but convincing them and teaching them and showing them the way. Because eventually we are responsible for the people we live with. If you think about it that way, whether they are your spouse or they are your children, we got to know and teach them to do the right things in the way that is respectful.
Honey, but sometimes if you have a husband that if you try to cook the healthy foods, it doesn't taste well. So I know some people will add the butter, the salt, things that to them will make it tastier for them to eat. Indirectly, you are killing your husband.
Yeah, that's what people are saying.
Yeah.
That I have to. I think this is a comment that we actually had from a friend at church.
Yeah.
That you ladies, they want to kill us. They give us all the good stuff, the butters, the meats, and the blah blah blah. And then when you go to the airport, you travel, and your people from back home see you, and they're like, if you are not big, they think that you didn't make it. If you are big, they call you chief. They call you all the names because now you are showing that your belly is big. You carry money, and it's all bad. That person,
anymore.
it's no longer like that. In the historic past, when knowledge was scanty, we thought that when your belly is big and when you travel or if you are an adult and you are working in a good job, you should be big. Those days are long gone. Today, the rich people are the skinny ones, even if you don't have money. So today, I'm the rich one. Even if the money is not there, that is how you show people that you're taking care of yourself. Literally, that's what we mean by saying that.
My point here is more like it's not just the taste. Some people, maybe you will feed them at home, you're giving them the healthy stuff. They go somewhere and they eat, and they're like, "What? This food really tastes good." But you don't know what they put in. For all that they put in, or their unhealthy things.
The Maggi cubes, all the sodium,
and all the salts, the extra things that they add to foods just to make it tasty. It's not about that anymore. It's not about the taste. Now we are going for the health. So if you're cooking at home, you have to make sure that you make the right choices so that you put it together. You are aiming for health, being eaten right and eating healthy, more than just making it juicy and oily and salty just for the taste. That is past gone, and we don't care about tasty food, and we are going for health.
Going for health. I'm going for health. And then, I mean, saying that somebody may think that, so the healthy food is not tasty. Healthy food can be made tasty. I mean, you've been cooking some healthy food that I'm like, wow, where were all these, before we knew about, what we got to eat and stuff. We were just eating for eating's sake. But let me just make an example. When you did, what's the name for that root? That yellowish,
the
squash or what?
The squash.
Squash, and then also sweet potato, baked sweet potato and squash. There's tons of potassium in sweet potato. Cut it up with some tilapia or some salmon, bake it together with some green. Come on, I'm beginning to get hungry. Come
on. And speaking of diets, I think Apostle John Ofori also posted something this week. He posted a healthy diet, and I liked it. That was really good, with 2 eggs on the side, and I think the squash and greens and all that. And he mentioned that mom's recipe is available if you want to find more new way of eating and feeding yourself.
I see. So healthy food could be tasty. It's not like they don't taste good. If you take your time to do it, you can make it tasty and yet it is healthy. That's the point that I'm trying to get across. So don't let it sound like, oh, so healthy food. No, it tastes good. It tastes really good if you take your time to make it. It's just that because you are particular with it, you don't add the extra ingredients that people just think that they are. I mean, if you're going to make it tasty because you're adding tons of Maggi cubes because of the salt and the flavor, you are taking out the taste. But if you cook the food itself and added certain things that brought the natural flavor from the food, that is what makes it tasty. And so we're hoping that you could do that. But then don't forget that our last two shows we talked about exercise.
Right.
Because if you eat in even the healthy foods and you are not active, they are still eventually going to turn into glucose and linger around. So you got to have an active lifestyle, which makes sure that you are burning up at least some of the glucose for the most part, so that you don't end up storing them in the form of glycogen in your liver and then also around your waist to make you have a pot belly and all those bad stuff. All right, so I think we are almost done, but there's a comment that I posted before. Brother Ben, another regular viewer, also says, good presentation, and we thank you also for being on. My goodness. All right. And so I think we're going to go forward. I think we may have already finished, and we're moving to what we are going to talk about next week. So next week, we are going to talk about meal planning for diabetics, and not just diabetics, but for people who don't want to be diabetic. So make a point with us again, same time, 6 p.m. Eastern time, and 11 p.m. GMT, wherever you're watching us from. I know people watching from Ghana, people watching from India, and people watching from Pakistan, Asia, and other places. Make sure that you are tuned in. We're going to be talking about how to plan your meals if you are diabetic or if you don't want to become diabetic. So both together. So that is what I think we have for today. Do you have any last minute addition? All right. So we want to thank you, all those who watched the live and those who are going to watch later. I know some people schedule don't allow them to watch live, and people who joined last week and are going to be watching later, we say thank you, and we say that we will definitely see you again. And until we see you again, we say, beloved, we wish above all things that you prosper and be in health, even as your soul prospers. God bless you. Thanks for watching.
Thank you.